As the US confirms more daily cases than ever before, we're asking whether America's new spike of infections will be as deadly as the first. This is Coronavirus, the latest from The Telegraph. I'm Theodora Louloudis. While cases in Europe are on the decline, America's curve is going the other way.
In the U.S., concern keeps growing as cases of COVID-19 are rising in at least 29 states. Among the hardest...
Daily cases in the United States peaked in April, then fell, stabilising at a daily total of around 60 cases per million people. Then, in mid-June, they began surging rapidly. The country's now past 100 cases per million people, more than 5 times the rate in the UK and EU. This in the country that's already seen more deaths than any other, at over 126,000. And on Thursday, the US confirmed a record number of new daily cases. Increases President Donald Trump puts down to more testing.
When you do testing to that extent, you're going to find more people, you're going to find more cases. So I said to my people, slow the testing down, please.
To discuss whether this is indeed the case, I gave The Telegraph's Washington editor, Nick Allen, a call. How are things, Nick? You've had a busy few months, weeks, years.
Yeah, it's been a busy time. We've had, schools we've had schools closed and stuff, so it's all been quite busy with our 2 small kids and stuff. But also just generally with the news, it's been a busy news time. Protests and all that.
And that election thing that's going on.
Yeah. So,
Nick, on Thursday, the US confirmed 40,000 new cases. That's a record daily high. To what extent can this increased number of cases be attributed to higher testing?
There's certainly some elements of more testing contributing to more positive cases. It's just logical. But it seems like there are other factors at play. Donald Trump's tried to attribute it all these extra cases, these new record. There was a record on Thursday, there was a previous record on Wednesday, and you're looking at 40,000 positive cases per day, and we haven't seen that since April. But to say that it's all attributable to that extra testing is a bit disingenuous. The other factors at play really are, one, that some of the states, according to the public health officials, just opened too early. And, they were very keen to get their economies going, particularly states like, there's a clear divide between states with Republican governors and states with Democrat governors. The governor in each state is basically in control of when that state reopens. And it's been interesting to see how little power the federal government and the president has. The president can say, I want you to reopen, but actually the power to do that lies with the governor of each of the 50 states. So in states like with Republican governors like Texas and Florida, they decided to open, public health officials would say, too early. And we're now seeing the effects of that because they're getting spikes.
You can also discern quite a lot, I think, if you look at the timing. I mean, you can see a sudden rise in mid-June, really, and there wasn't a big rise in testing then, was there? But that's when the surge began. And mid-June is also 2 weeks after quite a crucial date in the States, isn't it?
Yes, so this is a very US-specific thing. May 31st in the States is Memorial Day, and it's traditionally the start of summer, the unofficial start of summer. That's when everyone starts going to the beach. It's when students, young people, start going out, having summer parties, gatherings, and that's what happened. You had states, for example, Florida. There were images of the beaches being, swamped with sunseekers on Memorial Day, and I think we're getting a bit of that now in the UK as well. Obviously, you're then seeing a knock-on effect several weeks later, where people have clearly picked up the virus and passed it on. You've also had, in addition, you've had lots of mass gatherings. You've had all the protests, all the Black Lives Matter protests, and to what extent that's contributed is impossible to quantify. But it's clear, it may well have had some effect. You've also got the issue in the States that it's taken time for the virus to spread. So obviously, New York was the epicenter at the beginning, and other northeastern states like New Jersey were very badly hit. And it seems to have taken time for it to really erupt in the South and even across in the West, in California, which had a record number of cases the other day. So those states, Texas, Florida, Arizona, Arkansas, Nevada, Oklahoma, out into the west, Nevada, California. Those states are the ones that are really being hit now. And it's not so much a second wave, it's just that the first wave has taken time to reach there.
What's interesting is that we're seeing a rise in cases, but we're seeing a drop in deaths, aren't we? Do we know why that is?
Yes, this is interesting. The headline figure is always, there's a record number of cases. Yeah, it's been over the last week. But if you look beyond those figures, you see that the number of deaths is quite stable. And it peaked at sort of 2,000-ish, nearly 2,000 a day in April, and it's now sort of stable-ish around kind of 600-ish, and it's been that way for a while. And what seems to be happening is that it's because the average age of people who are testing positive has plummeted. So, for example, in Florida, the average age, during the early phase, the average age of someone testing positive for the virus was 65. And it's now 35.
Wow.
So it's nearly halved. And that's repeated across several other states. And what that means is that those people who have contracted the virus have much better medical outcomes. They're not being hospitalized as often. And even when they are hospitalized, they have a much better chance of survival. So therefore, the actual number of deaths is not going up. You've just got a lot more people who are getting sick, but not as sick.
Okay, with all that in mind about the demographics of the people who are now spreading the virus in the States, does that give us hope that this new spike in infections won't be as deadly as the last one, Nick?
At the moment, it looks like deaths-wise, no, because the proportion of deaths to positive cases is much lower. But it's impossible to say exactly where it's going to go. We don't know what's going to happen in a few weeks' time, in a few months' time, when these young people have interacted with their older relatives.
Particularly states are opening up.
Yeah, when states open up, and that means that so further down the line, it could lead to more deaths. It was interesting that the head of the CDC yesterday said, he's one of America's top health experts, and he said that 90% of the population is still at risk. So you can still have massive outbreaks. So that would, in a sense, that would suggest, yes, you could have a spike as deadly as the first. On the other hand, with the age of of those infected going down so much, that seems less likely. And another factor is that doctors themselves have come up with better ways of treating patients. So they're getting, the word from the doctors is that they're getting better medical outcomes. They're having to put less people on ventilators. That means that in theory, even if you get more positive cases this time, you will get less deaths. But I think, as the top infectious diseases expert here, Anthony Fauci, at one point just said, "Look, I don't know. I can't tell you what's going to happen because we haven't been through this before." So the likelihood is that we won't see as many deaths as we did a few months ago, but actually we can't really tell for sure.
Dr. Fauci advises the governors, but as you say, Nick, the power does lie with them. He's been very vocal about not reopening too soon. In fact, he's always said that opening too soon would set states back because they'd have to go back into lockdown. And that's actually happening in some places, isn't it, Nick? Whilst others they've pressed the pause button on their reopenings.
So the big one is Texas. Texas is it had been a kind of a trailblazer in terms of reopening its economy. It was well ahead. It started opening up in early May. And it had reached a point where things were not entirely back to normal, but relative. It did things, like open hair salons and so on very early. The restaurants had reached, reopening to 75% capacity. And what's happened now is Texas, like a host of other states, has had a record number of cases. We had 5,000 positive cases the other day. So despite the Republican governor, who was very gung-ho about reopening the economy, has had to step back and say, okay, we're pausing everything for the moment. We'll stay as we are, but we're not going to the next phase of reopening, and we're just going to wait and see what happens. He's also suspended elective hospital surgeries to create more bed space. And there's some very bad predictions about some of the cities, what's going to happen next in some of the cities in Texas, particularly Houston. And Houston, the main medical center in Houston, as of a couple of days ago, all the ICU, all the intensive care beds in Houston are full. So they are looking at potentially becoming the next worst place in America. That's replicated in other states. North Carolina's put a 3-week freeze on reopening. Everyone's basically, a lot of the governors are now, who've been pushing ahead to reopen, are now taking a breath, taking a pause, and saying, look, we've got this spike. Let's just see how it plays out over the next few weeks before we do anything else.
The power does lie largely with the governors, but the messaging comes from the top. What's Donald Trump been saying?
His position is very clear. Reopen. He wants to get back to normal. He refers to his view of the current spikes is that he uses the word embers. We've had the fire, and these are the embers. There's going to be outbreaks cropping up every now and again. It's going to spike, but when that happens, you deal with it and move on. He's been horrified by the unemployment figures, particularly. America reached 15% unemployment, and these are near Great Depression levels. His whole re-election his whole re-election strategy had been centered around the booming economy. Obviously, coronavirus has devastated the economy, and his re-election is now partly about the economy and partly about how he's handled coronavirus. But what he's really aiming for is to get states reopened and then have a bounce back in the economy in the third quarter before the November election. And if things are moving on an upward track, then he can say, look, it's okay, we're bouncing back, and the economy will be great again. And he really needs that to happen, because at the moment he's 14% down in the polls to Biden, and there are predictions of a landslide.
The rest of the coronavirus latest news. The proportion of coronavirus deaths in English hospitals has fallen since the peak of the epidemic. University of Oxford researchers found that 1.5% of those hospitalised with the virus are dying in June, down from 6% in April. The analysis says the fall could be down to the changing season, improvements in treatments, and changes in the patient population. Nicola Sturgeon says Scotland isn't far from eliminating the virus. The country recorded no new deaths in the last 24 hours, the first time Scotland's confirmed no new deaths on a weekday since the 20th of March. It means the death toll in the country remains at 2,482. Scotland confirmed 17 more cases on the previous day. Sweden's accused the World Health Organization of a total misrepresentation of its data, as the UN body listed it among 11 countries facing a resurgence of cases. The country's state epidemiologist Anders Tegnell insisted the country had an increased number of cases because of increased testing, but the number of serious cases was falling. Sweden's seen 5,200 deaths with the virus after it chose not to introduce strict lockdowns. As always, you can read more on any of those stories by following the links in the episode description. This is Coronavirus, the latest from The Telegraph. I'm Theodora Louloudis, and I'll be back on Monday evening with your next podcast. In the meantime, head to telegraph.co.uk/audio, where you can get 30 days access to The Telegraph completely free. For anyone wondering whether now's the right time to book some flights, I'd use that offer to read my colleague Greg Dickinson's piece on the gamble many of us are weighing up over the weekend. We might not know about the first air bridges until Monday, but Greg will tell you if there's any advantage to booking now or whether you should hold fire. If you've been finding these podcasts useful, I'd really appreciate it if you could tell me that. You can do that by leaving a 5-star rating and a review on Apple Podcasts. It's partially, but not entirely, for an ego boost. It's mainly to tell us whether we're giving you podcasts you like listening to. To get in touch, email coronaviruspodcast@telegraph.co.uk, or you can find me on Twitter. It's @T_Louloudis.